Hi, it's Dr. Greg Jantz, founder here at the Center, a Place of Hope. Hey, as I have over the years now authored 45 books, what are the areas that we look at and that we see that's increasing is that of OCD, obsessive compulsive disorder. Now, there's a unique area that this is increasing in, and I've been looking at this and looking at this, and it's the impact of the tech industry pressure, so the pressure, and how it can push you over where it looks like obsessive compulsive disorder. You get all the symptoms, the fast paced nature of technology, any small mental health struggles you might have, sometimes are all amplified. If I've had a tendency towards depression, if I've had some over anxious in my life, or I've had a tendency with some of the obsessive compulsive traits and checking and rigidity in my thinking. And then all of a sudden, all this pressure, and the pressure is coming from the job or the expectations or the internal expectations, but the pressure is winding me up where I now look like I have all of these. My depression's increased, my anxiety's increased, my obsessive compulsive disorder's increased, and I'm hypervigilant, I'm on edge. And you go back, where's this coming from? Not that it's the source of it, but the high-tech pressure can help elevate all these symptoms. Obsessive compulsive disorder, I made a note here. It's a disorder that causes individuals to experience obsessive thoughts and then compulsive behaviors. Obsessive thoughts and then compulsive behaviors. What's an obsessive thought? It's an unwanted thought. It's the rumination. It's the recycling. It's, I don't want to think about this, but boy, do I. Then the compulsion is the repetitive actions, the behaviors that I end up doing. Obviously, this affects our whole life. And we become preoccupied with the thoughts and then the behaviors, the compulsions. A lot of high pressure and stress can push us in this direction. Long hours, tight deadlines, pressure, maybe even for constant innovation, it can lead to a lot of anxiety and then trigger these obsessive compulsive symptoms that could have always been there a little bit. There is a perfectionism and work culture that can add to this. The tech culture can really amplify perfectionism, and I'm going to say perfectionism and precision, and a sense that I have to do everything just right, and it has to be right the first time, and it has to be a spectacular right, the perfectionism. Sometimes unrealistic standards. All right. The other one to look at is this constant, I wrote down constant connectivity. The pressure really around the clock, constant modifications, emails, messages, colleagues, they're nonstop. And it can keep our mind in a heightened state where it's really difficult to unwind or disengage from stressful thoughts and tasks. It just can't seem like you can. That's like there's never a vacation because I can never unwind. So how OCD, here's what's important, how OCD symptoms manifest in tech industry: overworking and burnout. Yep. Severe exhaustion. And the burnout leads then is the seedbed to that obsessive thinking, and then the compulsion, the behaviors. And remember, the behaviors are to provide me relief. I need relief from this. There's all the anxiety. It's a habitual state of anxiousness. And this is where addiction, drinking, escapism behaviors, the compulsions really can sneak in, sometimes subtly, but before you know it. For example, we've worked with pretty high energy tech workers who, started, maybe they're working from home. They started drinking around 3 in the afternoon, alcohol at the end of their day. Time passed along, and now they're drinking at 1 p.m. right after lunch as they're continuing to work, looking for a release of the pressure. It's also where a lot of mistakes are made. All right. The social isolation, as much as technology may be promoting connectivity, I may really feel a total loss and isolation could be severe. Now, that means because I may be working primarily alone, though I have a lot of connections, I'm still really isolated. I'm isolated in maybe true relationships. Coping strategies. What do they look like? Well, there is something called setting boundaries. I'm not available 24/7. And though there is the expectation at times, but having appropriate boundaries, performing really well, but having appropriate boundaries. The person that wakes up at 2 a.m. and starts working and is stressed out all day long, and they're not doing self-care, they're not eating, they're not sleeping. So, and then number 2, we've got to find a way to provide relaxation, renewal, and I'm going to say reset to our physical body. To our physical body. What's that look like? It means maybe it's a 20-minute walk in the middle of our workday. Maybe it's drinking my water instead of 10 cups of coffee. I've got to provide relaxation, good nutrition to my body. I could be, with chronic stress, I could be promoting inflammation in my body, which can set up for a lot of other issues. All right, I think there's a time where we really do need to seek some professional intervention. We work a lot with technology folks and high-performing individuals here at the Center, a Place of Hope, because one of the things that happens is you eventually will crash. And the OCD and everything else that you're doing to try to cope, there reaches a breaking point. And so that's a lot of times when we see somebody at the breaking point. And they always ask, well, when I'm coming, but when I come, can I bring my laptop and work during my breaks? You see what's happening? Sometimes we just need a really clean break for a period of time in order to rebuild and then restart. All right. And I just want to say, I love working with the tech folks. Love what technology is doing for us mostly. And I do believe that we can learn to self-care and improve our, if you will, performance. And we can improve our relationships. But we've got to expand our point of focus a bit. All right. If you know somebody who's struggling with OCD, irregardless of the type, visit us at aplaceofhope.com. The whole person approach that we started in the early 80s, we're still doing it. And the whole person approach means I'm going to look at every area of my life, even my physical health, and I'm going to put together a whole person plan. So a good place to start is going to aplaceofhope.com, gather more information, and there's a tab that says test. There's a test. It's a confidential test that applies to this topic. That is just a place to start to get some information. All right, aplaceofhope.com.